Hello, hello, and a wonderful good evening to all of you. Thank you so much for joining me. Again, my name is Dr. Williams, aka Queen, your family friendly cancer doctor. And I want to thank you for joining me. Here on this channel, I try to educate you on just the basic about your health, how to take care of your temple. So hopefully you won't never have to see a doctor like me who are cancer doctors and oncologists. So we had a very interesting time last week, well, 2 weeks ago, where we talked about cervical cancer, and I just did not have enough time to get into uterine cancer and more about what to look for in regards to uterine cancer. So I won't be before you long today. And I laugh because every time I say that, I tend to get a little bit over that 30-minute time frame. And I'm really trying to keep it within that 20 minutes, 30 minutes. But guess what? We're going to go right ahead and jump in. So I want to thank you for joining me. If you are on YouTube, please do go ahead and subscribe, ring that bell so that you're notified every time I go live. And please do like as well. If you're on Facebook, please do follow, and you will also see notification when I go live. I tend to do these sessions twice per month, the second and the fourth Tuesday of every month. And this one kind of crept up on me because of how the month started. Nevertheless, we're going to be covering some detail here today, and please share the link. And if you missed the past ones regarding cervical cancer, colon cancer diagnosis and screening, etc., please go on the YouTube channel. They're all there saved under past live session. So let's go ahead and jump in. And I like having these here because this is just a quick reminder to take a pause and please take a moment to review the medical and health disclaimer. This is very important because you need to know that I am not a part of your medical team. This is just information that I am giving to be of benefit and added value to your life and taking care of you. So don't make any changes based on these videos until you talk to your primary care professional, be it the nurse or PA, whomever it is. But I do encourage you to verify these details. And these details can change as well because these are cancer screenings and some of this change as time goes on. So whenever this may be that you're watching it, please remember that you need to check with your primary care or whomever it is that is taking care of you, and know that these recommendations, guidelines, they do change with time. So, oops, I'm all the way here back at the end. So let me scroll to the beginning here. And we are going to jump into talking about postmenopausal bleeding and cancer. If you are now, if you are postmenopausal, we'll go into defining what postmenopausal is and what that means, what the age ranges are. And some folks can go into menopause because of diagnosis such as breast cancer, etc. So you need to be aware of whether or not you're postmenopausal. So the things that we're going to be discussing today is really based on vaginal bleeding in the postmenopausal setting. So let's jump right in here. And oh yes, Anita reminded you that I did a colon cancer screening about a month ago, and there was a correction that needed to be made, and that is there was a change from the American Cancer Society and the US PS task force that notes colon cancer screening now begins across the board at age 45. So just remember that and go get a colonoscopy, y'all. Don't play in your poop. Get your colonoscopy. That is the gold standard. So, yes, so thank you for joining, Angelica. There you are. Always, I'll keep this in for about another 3 or so. Just a reminder, folks, that if you are age 45, that you need to get your colon screening. And remember, if you're at higher risk, it may be sooner. What's higher risk? Check out the previous live broadcast on my YouTube channel at Queen Quanta, and you'll learn more all about that. So please go ahead, get your friends on board, especially if they're postmenopausal over the age of 50 or so. Get them on, have them listen. They may learn something and just may make a difference in their life. I always love to start with this slide because there's a lot under the hood. I like to say that people take better care of their vehicles in most cases than they do their bodies. And our bodies are so much more complicated than a car. Yes, it is. And there are different systems throughout your body. And I go through different areas and talk about different things. And we're in the and more because we are in the gynecological region where we're talking about the female parts in the pelvis. So we have to take better care of our bodies. Don't have a better vehicle, your vehicle being taken care of better than your own self. So now we're going to jump into the basics you need to know about uterine cancer. We're going to start again, as I like to do with basic anatomy. You need to know where these are located. Where are all these things located that I'm talking about? We're going to review what is postmenopausal bleeding, what are some of the causes, look at uterine cancer, what are some of the symptoms, and as always, visit your doctor. I will always give my disclaimer here. You're not going to say, well, Dr. Williams said it and that was enough, or Queen said it and that was enough. No, 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 no. I am not the end all be all when it comes to your care. You must follow up with your primary care and ask the questions that these presentations may generate. So I'm encouraging you to advocate for yourself. And again, the reason why I'm doing this, as a radiation oncologist, I consider myself as the anchor leg when it comes to cancer treatment. So I tend to see patients after they've already been diagnosed with cancer and after likely they've had surgery or maybe even chemo, and then they come for radiation. And a lot of the times I get all these questions where that should have been answered up front. And I'm thinking, well, can I make a difference in one person's life by bringing these information to you live? So I hope that this information is beneficial to you and will make a difference, but please do share the knowledge as well. So let's jump into talking about endometrial cancer. I like to start with this estimated new cancer cases. There's males and there are females. And on the female side, you'll see that uterine cancer is down at about the fourth most common diagnosed cancer there. And on average, it says there's about 43,000, but I've seen it increase somewhere, different numbers based on what year you're looking at. That's upwards of 60,000 new cancer diagnoses per year. So it's actually very common in for females. Let's start off by talking about the location. Where is the uterus? What is endometrial or uterine cancer? Because you need to know, is there really a difference or is there not? So let's jump into that. So again, where is the uterus? A lot of things occur within the female dynamic, which I like to say is anything below your belly button, right? We'll say below the navel, below your belly button, all that is called, that region is called the pelvis. And as you're looking straight ahead here, what you're looking at is we went into this last time and we talk about the uterus, the vagina, how it goes up into the cervix and then into the uterus. And off to the side, what you're seeing are the ovaries and also where the fallopian tubes attach. Now, for those of you who are probably more a little bit seasoned, you're like, what? Ovary? Oh, what? Ovaries? I don't remember any of those things. And that's why I like to do a little bit of a refresher before I jump into talking about these diagnoses. Now, as you can see, we're just looking at the body. What we're going to do now is as though we're doing cutting it in half, like cutting an orange in half. So imagine cutting from the midsection all the way down, and we're going to look inside that area and what is there. Good evening, Brenda. Thank you so much for joining me. Appreciate having you here today. Again, please do share with others. We're talking about uterine and endometrial cancer that affects women who are postmenopausal. All right, so now let's look on the inside here. What happened? So now we're going to take a look at the uterus where we're kind of just imagine having an orange and we're just slicing it from top to bottom and we're looking on the inside. So this is what we are going to do next. So let's take a quick look on the inside. It's important for you to understand when we're talking about the endometrium and the cervix and all that stuff. It's you cannot see it, right? You cannot see it with a naked eye. It's different when we're talking about breast cancer because the breast is right there. It's on top of your chest. You can see it. You know what's going on. If we're talking about head and neck cancer, you can, for the most part, see it if it's the oral cavity. You can see your lips. You can see the anterior part of the tongue. If we're talking about a cancer on the skin, you can see that. When we're talking about more internal organ, a lot of patients have difficulty trying to understand what is being done because they don't understand the geography of your body, if you will. So that's why I like to show this. Now, today, well, last couple weeks we talk about cervical cancer, right? And we talk about the vagina here where the arrow is, and that could be about 10 centimeter in length, but that varies. The cervix is right there at the top of the vagina. Now you'll see here this arrow spreading across and it says uterus. And then you'll see the endometrium. Now, the uterus is typically what we refer to as the womb, right? That's where the baby is attached on the endometrial area, and that's where the baby is within the womb. We refer to that scientifically or anatomically as the uterus. Now, there's a difference between the uterus. The uterus is the whole entire thing that you're looking at there that looks sort of like, I don't know what kind of shape that would be, but sort of like an egg shape. That whole thing in the center, that's the whole, all of that is considered the uterus. And the endometrium is the inside lining of the uterus. So think of it like a glove, if you will, right? So the whole thing would be the uterus and the endometrium is the lining inside of the glove. We'll talk about why that makes such a difference. Before we jump into that, let's talk about postmenopausal bleeding because that's what brought us to this topic. It's important for you to understand that, well, Postmenopausal bleeding, you have to understand, first of all, what is menopause, right? So, menopause typically occur in women who have stopped having their period. That means your body isn't making certain hormones anymore. And this typically occurs between the age of 45 to 55, where the changes start to occur. So you'll hear the terminology of premenopausal, meaning that you're still having your regular menstrual cycle, perimenopausal, where you're in that phase between 45 to 55, where your cycle isn't as regular anymore, and you're being told by your doctor that you're in the perimenopausal setting. And then postmenopausal is after you've stopped having your period, and that has occurred for at least a year. Now, there are other ways to check to see if you are postmenopausal, and that is by looking at some blood tests here, the FSH and estrogen. And there are some symptoms that go along with the postmenopausal setting as well. You know them. The hot flashes are, as some folks like to refer to it, your personal summers, right? So there are a lot of things that can occur in the postmenopausal setting. Won't go into details with that, but if you feel that you're perimenopausal or postmenopausal, you can actually have that confirmed by visiting with your primary care, and there are tests that they can do. Now, if you're 75, chances are that you are postmenopausal already. But if you just want to be sure, you may get in touch with your primary care and they can do the blood test. And if you haven't been having any period at all for over a year, then you can know that you are postmenopausal. Okay. Now, this will be different if, for example, you're on some kind of birth control pill or an IUD, an intrauterine device or stuff. And so that's why, here comes my disclaimer. There could be a plethora of things going on with you. The important thing is that you get to know your body. And when there are changes, you need to have a conversation with your doctor. So, this general information that you are receiving is just general, exactly that. But I'm also trying to make you an advocate for yourself in knowing when there are changes and what to do about them. So, postmenopausal bleeding tend to occur for those who are haven't had their period for over 12 months or over a year. Okay. So now we know what postmenopausal is. What are some of the common causes for postmenopausal bleeding? The biggest thing is actually a benign cause, being that endometrial atrophy. What does that mean? It just means the lining. Remember, we looked at that earlier, where the endometrium is the lining of the uterus. And that just means that the endometrium lining is shrinking. It's not being used anymore. And when it's not being used, it can actually cause some bleeding to occur. So a lot of the time you may have bleeding and it may be benign, it may not be an issue. I caution you, do not self-diagnose. There is nothing normal about having a period after you've been in the post-menopausal setting. So if you're in your 60s, listen, and you start having quote unquote period, let me tell you something, ladies, you're not getting young again. I've heard someone said that. It's like, well, maybe the clock is reversing. The clock does not reverse that way. No, 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 my lovely lady friends here. No, sister friend, listen to me. If you are postmenopausal and you're having bleeding, that is not normal. Now, sometimes you're on hormone replacement therapy, and that can cause you to have some abnormal bleeding. And about 10% of the postmenopausal bleeding are actually associated with cancer. Bottom line, come closer, bottom line. If you have not been having any period for over a year and you're not on any sort of birth control, you are greater than 55, or you know you've been told you're postmenopausal, and you started having bleeding, make an appointment immediately to see your primary care. They will look at it themselves depending on how they practice, or they may refer you to a gynecologist. But remember, you need to be evaluated. If you have a girlfriend and they're like, oh, I think I'm getting young again, I'm bleeding in their 70s, no, they need to go to the doctor. This is serious, serious. So, why is it that postmenopausal bleeding may signal cancer? Now, in the postmenopausal setting, your estrogen is low, and that causes your endometrial wall thin. And there's a lot of biology that goes into it that you really don't, need to go into in depth. If you do want to, you can always go on search on the internet and you'll find a plethora. Depends on how deep you want to go. I'm just trying to keep this surface level to educate you so you are aware what to do if there's any abnormality. If there's cancer developing along the endometrial lining, it disrupts it, and that can cause bleeding. Again, if you recall, we looked at the picture and we talk about the endometrial lining being inside of the glove, right? So that is thin out. There should not be any bleeding there. And so now, because the cancer disrupt the lining, it's bleeding. And I'll get a little bit more into why that can occur as well. The first line test that is usually done is a biopsy, and this is typically done in the office. So you have a bleeding, they'll go in, they'll do an exam, and they'll take a look and they'll try to biopsy it and see what it says. They also look at the thickening of the endometrium because, again, if you're postmenopausal, remember, it's supposed to be thin. It should be like paper, nothing should be there. So if there's any sort of thickness there, that is a sign something abnormal is going on. Now, MRI for staging. I'm going to use this whenever I mention MRI in any of my cancer screening, evaluation, presentation. I always say this. If you are claustrophobic, think you may be claustrophobic and you hear the word MRI, please, please, please tell your primary care or whomever is ordering the MRI that you think you may be claustrophobic, because when you're having an MRI, you actually go into this tube like tunnel and it's very loud and it's very close around you. So you don't want to miss that appointment. So when you hear the word MRI, you think you may be claustrophobic or think you want to ask your doctor, excuse me, can I have something to relax me so I don't get scared going into this tube-like thing? And it's very loud as well. So it's better to be prepared and still get an important evaluation than get there and not be prepared and miss an evaluation. And let me tell you, depends on where you are. Getting an MRI schedule can take a long time, so you don't want to miss that important appointment. Now, the statistics show that if you are diagnosed with endometrial cancer or uterine cancer early, 95 for the 5-year survival rate is over 95%. So it is important to get in and get screened. Anything abnormal, go in to your doctor. So here's a good picture we can go through again, talking about what is a uterine cancer. Now, I think there's a chart coming up talking about the difference. But when we talk about uterine cancer is anything that can occur for the entire womb. Okay? Now, endometrial cancer, remember, is the lining inside. So you see the bigger organ, and inside where you see those abnormality, that's the endometrial lining. And endometrial cancer can account for up to 90% of uterine cancer. Cancer disrupts the balance and causes abnormal bleeding. Again, remember, you're postmenopausal. That lining is thin. There shouldn't be anything there. So if you're having bleeding and you're postmenopausal, you haven't had any bleeding for over a year, get in to see your doctor. Okay? All right. So you may hear the terms uterine and endometrial cancer, and it seems as though they're using it interchangeably, meaning they may mean the same thing, but that is not so. Endometrial cancer, again, remember, is the lining of the uterus. That's the lining of the womb. And that is very common. And typically, you would present with the early signs like bleeding. Uterine cancer can occur anywhere in the uterus. That's anywhere in the womb, to use a terminology for the seasoned folks who are out there, like the baby boomers. You're used to hearing the term womb. Well, uterine cancer can occur anywhere in the womb, and that include endometrial cancer and sarcoma. So the term uterine cancer is a more broader category, and that include not only endometrial cancer, but sarcoma. Sarcoma is typically like a cancer of the muscle. So the womb is like a muscle that can stretch. Endometrial cancer, you can discover much earlier. Why is that? Because you tend to bleed. With sarcomas, that may not be the case. With sarcomas, they may grow and get to be much bigger before you even know that sarcoma is occurring. You may have other symptoms, pelvic pain. We'll get into that in a minute. But it's important to know the difference in the term. Uterine cancer just covers everything. Okay. So let's look at just the facts about uterine cancer then. So, uterine cancer is the most common gynecologic cancer. The incident and mortality rates has been going up since 2007. And, we don't know if that's because folks like yourself who are watching this is just a little bit more attuned to their body and is therefore getting checked out, or it's just a rise in uterine cancer overall. Now, the sad thing here is that Black women are 2 times more likely to die from uterine cancer than their white counterparts. Why is that? Whatever the reason, that's why I'm doing this here, to educate you, to let you know that having your period after you've had or gone through the changes, like we like to say in the Black community, going through the changes, you've gone through the changes, 2, 3 years later, you're starting to have your menstrual cycle again. I've heard someone even said to me, "Well, doc, I thought I was postmenopausal, and then I started bleeding again." And I was like, "Wait a minute, say what?" Right? My ears perk up because I know what to listen for. It's like, if you were postmenopausal and you haven't had a period in 2, 3 years, and then you start bleeding again, sister friends, that is not normal. And you notice I keep repeating this because I want to make a difference in this. Black women are 2 times more likely to die from uterine cancer. We need to change that. And part of that is education. And that's what I'm doing here. I don't want to see you on the other end as an oncologist. I want this to be prevented. If you have any questions, you could go ahead and drop those questions in now as we're rounded near the end. We're going to talk about some risk factors. But again, the statistics show that 75% of endometrial cancer present with postmenopausal bleeding. And that's why I'm talking about this today. Bleeding, ladies and gentlemen, if you're watching there, young gentlemen, and your significant other started to have bleeding after you thought they have gone through the changes and they're in their 60s, you need to go get checked. In their 70s, you need to get checked. In your 80s, you need to go get checked. Now, I'm going to pause right here just for a second because I want to address the LGBTQ, or for those who have had the transgender or the sex change. Again, forgive me for my ignorance, even as a physician. I actually don't know, and I will educate myself on that. You see, I don't know everything, but I don't know the type of surgeries that is done for any sort of sexual changes. So if you were born female and you're changing to a male, you need to ask, how will this affect any gynecological cancer for me in the future? You have to ask that question because remember, if you do not have a outlet, if you don't have a vagina anymore because the sex change and they've put a penis there now, then how do you bleed? How do you get these signs or symptoms? Chances are you'll be having abdominal cramping, and that may be a little bit too late. So you need to have these kind of conversations if you are having any sort of sex change, born female and changing to a male. You need to have that conversation regarding cervical cancer, ovarian cancer, uterine cancer. What can be done for screening for you, because they won't be able to do the gold standard type of treatment. All right. So let's see right here. Let's see here. Thank you for joining. It's a late, but glad to be here. Thank you for joining, Felicia. Let's go on here to the next. So, what are some of the risk factors regarding uterine cancer? Here we go again. Obesity. And why is that? Because remember, we talk about the estrogen, right? So, obesity and metabolic syndrome, we have history of prolonged estrogen exposure. And for anyone who's been diagnosed with breast cancer and you had to be on like tamoxifen or any of those medication, you may want to have a conversation with your oncologist regarding your risk for endometrial cancer. And I'm going to leave it at that. I'm not going to give you everything, ladies and gentlemen. I want you to take notes, and when you go in and have conversation with your doctor, you start talking about this. This is your body. This is your vehicle. This is your car. You need to ask the questions. And it's just amazing how diabetes and hypertension is just, you could find that in just about every disease, right? So let's stay away from diabetes and hypertension if we can. And if you can't because of genetics, let's treat that the best way that we know how. If there's a family history, such as with Lynch syndrome, and of course, age. The peak incidence is in the mid 60s and beyond. Can you have it earlier? Of course. If you experience or have your menopause at say 45 or 50, there are a lot of people who have their menopause early. Or if you're in the postmenopausal situation because it was induced because of some other type of treatment, then you need to be aware that, again, any sort of bleeding, not normal. Typically, however, the age peaks in the 60s and beyond. I know my heart broke when I had to treat someone who was 78 years old for endometrial cancer, and it was a little bit more advanced because they weren't paying attention to that. So let's look at some of the early signs and symptoms regarding uterine cancer. All right, so first thing, we already went into that, and I'll keep preaching it. I'll be repetitive. Vaginal bleeding or spotting after menopause. That's a trigger. That's an absolute trigger for medical evaluation. Don't go searching on the internet. If you haven't had your period for over a year, I'm saying it again, I'm knocking on wood here. If you haven't had your period for over 12 months and you've been told that you are postmenopausal, any sort of bleeding is not a reversal of the clock. Go in and see your doctor. You're not getting young again. Go get it checked out. If you're having pelvic pain or discomfort and any sort of abnormal discharge where it's coming out a lot to the point where you're wearing a panty liner on a regular basis and you never used to do that, there may be some foul odor associated with that, then you need to get that checked out as well. So again, anything that's different, ladies, anything. Write it down, take a note. You may look on the internet, but don't let that be your end all be all. Please go ahead and get it checked out. Thank you for joining, Ramona. That's okay. Better late than never. And remember, when this is done, it will be available on YouTube. I think it'll also be available on Facebook to review. Please just share. This is just information I want us to have. As you see there, that Black women are 2 times more likely to die from uterine cancer. And a big part of that has to do with education and myth associated with it. So again, first line is ultrasound, looking at the endometrial thickness, and a biopsy will be done in office if your gynecologist or primary care think that is necessary. But we need to get tested. Bottom line, I come back to this. It's like learning a new language. That's what it is. It's learning a new language. Learn to talk to your doctor, please. Write down these questions. Ask your doctor about the risk, screening, symptoms, everything. Ask your doctor these questions. All right. So today we went through a lot in this like 30 minutes or so, and we look at the basic anatomy. Where is the uterus? What is postmenopausal bleeding? What are some of the causes for postmenopausal bleeding? We talk about the difference between uterine cancer and endometrial cancer. What are some of the symptoms? And underscoring everything, because remember, with any guide, things are going to change, right? So always write these things down. You could check it out on the internet. Come back and watch this if you'd like. But bottom line is you must go and visit with your primary care and talk to them about what's going on. So we're coming near the end. If you have any question, you may drop it in. It's about 30 minutes here after the hours. I want to thank you for joining me. Again, the second and the fourth Tuesday of every month. Mark your calendar. The next time I'll be on here will be April 22nd and then on May 13th. I am looking at, there's so many different cancer topics to cover regarding screening. And I've been, folks have been asking me about prostate cancer. I may look at that. I don't know yet. If you have some idea of what you'd like to see next, just let me know. But again, I want to thank you for joining me. Let's go back here and have a quick little chat as I wrap up. I want to say, listen, postmenopausal bleeding, that is not normal. I have heard little chitter chatter, and someone actually said to me, it's been about 15 years ago, and it really caught me by surprise. And I'm going to say that line. I thought all the stuff was over. I was postmenopausal, and here I haven't seen my period for 2-3 years, and now here I go bleeding again. Don't go just get pads and deal with it, or Tampax, whatever it is that you use. No, this is cause for an alarm. Make an appointment, go see your doctor, let them figure out what's going on with you. All right, let's see here. Oh, thank you for joining, Adrian. Great information regarding any type of bleeding after you've gone through menopause. Thank you so much. Yes. And just share, because a lot of folks here are watching, and I know, if you're over 55, a lot of folks, a lot of females who are over 55. If you know someone who've had a sex change, you may want to make them aware of the type of questions that they need to ask regarding this, because I have treated prostate cancer in someone who has had a sex change from a male to female. So these things are important. First, I am a physician, and I care about you, and I care about everything that you are going through. So the next time we will be on here will be April 22nd. Let me know what topic you would like to hear about. Just drop something there on Facebook or on YouTube. I don't think my comments are on for YouTube, but let me know your thoughts, what you'd like to hear next. I am over by a few minutes here. I know some of you joined late. It does not matter. I am so grateful that you joined me. You may go back and watch the rest of this, or just share it with anyone you know who is postmenopausal or in their 50s, perimenopausal. They really need to know about this information. Okay, ladies and gentlemen, I am Dr. Williams, aka Queen, your family friendly cancer doc, and I am here to advocate, teach you how to be an advocate for yourself so that you can take care of your body. Please join me every Sunday for Making It Make Sense Bible Review, and every second and fourth Tuesday, 7:30 p.m. Central, 8:30 p.m. Eastern Standard Time, where we just go over talking about how we can be better stewards of our bodies. Until next time, this is Queen signing out. I so appreciate you joining me. I'll see you next time. Until then, be blessed. Take care. Bye-bye.